Okay, so this is our last session of the day, and we have three presenters. The first presenter is Wayne Lewchuk from McMaster University, the School of Labor Studies, and he's going to talk about his PEPSO Toronto Hamilton Survey, Precarious Employment and Occupational Health and Safety. And then a second speaker is Annabelle Bamford from the University of New South Wales. She's going to be talking about work organization and occupational health and safety in Australia and United Kingdom horticulture. And then the third speaker is Frédéric Descosses from the Centre National de Recherche Scientifique in France, and he's speaking about managing workers' health by making invisible and externalizing their impairments. The example of seasonal migrant workers in the intensive agriculture sector in France. And my name's Barb Nace, and it's great to be here.
Okay, well, it's great being here and having a chance to chat about some of our research. What I'm presenting today is really a joint research. United Way Toronto has been my partner for the last 5 years, and we've been collecting some of our own data, trying to understand what is going on in the work world, how it's affecting households, and how it's affecting communities. I want to sort of try and hit on three things in my 20 minutes. First, I want to talk a little bit about the limitation of using the form of the employment relationship as an indicator of precarity. So whether people are seasonal, contract, or in some kind of short-term employment, that's not a very good indicator of who's precarious and who's not. And the problem with that, it makes it easy to do studies that show that precarious employment is not bad for your health. And so I think it's really quite important that we become much more precise in understanding who is and who isn't precarious. Secondly, I want to talk a little bit about exactly how serious the health problems are for people in precarious employment, and in particular look at some of the characteristics of precarious employment that seem to be the most relevant in understanding both general poor health and poor mental health. And then last, and perhaps the most speculative, I want to start trying to make a link between some of the work we published in 2011 with Marlea Clark and Alistair Wolfe, looking at the impact of precarious employment on workers, linking that to the work I've been doing the last little while about the link of precarious work on household well-being, and arguing that the path from precarious employment, particularly to poor mental health, is not so much through your boss, because quite clearly having a boss can be bad for your health, but it's not so much through what's going on at the workplace, but how what's going on in the workplace is affecting your household and is affecting your community, and it's through those effects that the heightened levels of particularly poor mental health are showing up in workers in precarious employment. Okay, so let's try and get on with that. So, as Michael said yesterday, in the last few years, I've been working predominantly on the link between precarious employment and household well-being and community participation. And we've published a couple of reports along with the United Way, and these are both available at our website, www.pepso, P-E-P-S-O, not P-E-P-S-I, Pepsi, pepso.ca, and they really explore in a tremendous amount of detail how this new labor market is impacting on households and on communities. But today I want to make some different inferences from that same database. So the study itself that we've done is we've done two now waves of population surveys in the Toronto Hamilton region. We've got a total of about just over 8,000 individuals now who have completed our survey. All of these individuals are aged 25 to 65, and the only criteria is they had to work for pay in the last 3 months. So we have all the self-employed, we have the marginally employed. As long as they work for any pay, they were included in our studies. And we also have done about 111 interviews with workers in precarious employment to get a deeper understanding of what our numbers mean. So the first question is, how do we determine who's in precarious employment? And I hear much of this comes from, so the confusion out there right now is that if you use Stats Canada data, you don't see a tremendous uptick in people who are working contract employment. You don't see a tremendous uptick of people who are own account self-employed in the last 15 years. And that's led some observers to say, well, there's not a problem out there with precarious employment. Well, you believe that, and you'll believe the Liberals are going to make the world better. So there's obviously something else has to be going on. And so we developed this thing called the Employment Precarity Index, which looks at the characteristics of an employment relationship to try and determine who's in precarious employment. So just some of our findings, so this is one of the graphs that has caught some media attention. This looks at the form of the employment relationship, and basically the gold part of that circle, those are people in the Toronto, Hamilton region who completed our survey who are in what I call 1970s jobs. This is a standard employment relationship. These are permanent jobs. They're full-time jobs. They have some benefits, and people expect to have those jobs in a year, not in 20 years, but in a year, have at least 1 year's duration. The other half are in something else, and they're in various kinds of precarious employment. The dark gray slice of the pie, the 20.3%, those are people who are in forms of the employment relationship that we traditionally think as precarious. So these are short-term contracts, working through temp agencies, freelancers, own account, self-employed. The rose-colored quarter, a lot of these people told us, yeah, I have a permanent job, but I don't know if I'm going to have it in a year. It doesn't pay me anything else other than a wage, and some weeks I don't get any work at all. So these are sort of these zero-hour contracts. So they're permanently employed on call, basically, not necessarily permanently employed being paid. So the labor market out there is complex, and trying to understand the health links between these different slices is really problematic. So we developed a Precarity Employment Index. And we took the 10 questions on the left-hand side, and we scored people from our survey, and then we simply ranked our individuals based on their scores there. I think most of us would agree that if you're answering yes to a lot of those questions on the left-hand side there, that there's a problem with your employment relationship. This is not a 1970s job. If you're working on call, your hours are not stable, you're paid in cash, you don't have any benefits, and heaven forbid you could put your hand up and say, excuse me, but my job is killing me. What we don't include in this, and I think this is important, is we don't include income, because one of the things our project is trying to make a distinction between is poverty and precarity. And in part it's because what we want to try and capture is the spread of precarious employment beyond the low-wage worker, that this is now very much moved into what used to be middle-class incomes. This is the people who are working on contract teaching at universities. These are people doing research. This is freelancers, increasing number of people who in the past would have had 1970s jobs now are in various kinds of precarious employment. And when they are employed, they're relatively well paid. The problem is they're not regularly employed. So some years they'll make $80,000, the next year they'll make $10,000. And we need to make a distinction, we argue, between poverty and precarity. Oops. Okay, so I've turned this off again somehow. Okay, anybody know the secret word? There we are. Perfect. Okay, so this is I think a chart which shows us the problem of using the form of the employment relationship to measure precarity. So what I've done here is I've taken our employment precarity index and basically divided our 8,000 people into 4 bins of about 2,000 each. And so the group that scores the highest on our index, or the best is actually the lowest, so the lowest scores, those are secure people. They're in secure jobs. The next quarter are in stable jobs. The next quarter are in vulnerable jobs. And the quarter who answered yes to the most of those questions that we had in the index, we call those our precarious. So we arbitrarily just divide our sample into 4 groups. Along the index there, we've got 4 forms of the employment relationship. Those who told us they were in a standard employment relationship, that was that gold slice of the pie on the first figure. figure. Those who are in permanent part-time. The others, those are people who have permanent jobs, but they don't know if they're going to have them in a year. And finally, our temporary and contract, those who have precarious forms of the employment relationship. And what you can see, which I think is really quite critical, is at the top, most people who are in secure employment, the top quarter of our index, also are people who are in 1970s jobs. They're in the standard employment relationship. They have a permanent job. It pays benefits. They expect to have it in a year. So there's a correspondence there between form and the level of security. It's when you get down to the bottom, to the bottom down here, that things are a lot messier. Only 57% of those workers who told us the form of my employment relationship is precarious. So I'm a contract worker, I'm a freelancer, I'm own account, self-employed. Only 57% of those are actually in our precarious quartile. And fully 26%, or almost 1/4 of our precarious quartile, those are the ones who said, yeah, I've got a permanent job, but it doesn't pay any benefits. Sometimes I don't get any work in a week, and I don't know if I'm going to have that job in a year. And it just points to the need to be much more precise down there in identifying who's precarious, because it's not just the form of the employment relationship. It has something to do with the characteristics of the employment relationship as well. And so this is the danger of using the form of the employment relationship to try and measure the health effects of precarious employment. Here, along the bottom, we've used the 4 forms of the employment relationship. Are you in a standard employment relationship, permanent part-time, or others? So these are the permanent but not forever, and our precarious group. And this is just general health, the basic question. And what you can see is that those in the precarious are just marginally more likely to report their health is less than very good than those people who are in these 1970s jobs, the standard employment relationship. Likewise, if you look at mental health, again, you see a little bit more of a pattern, but still, it's not all that elevated. People in precarious employment are about 30% more likely to say they have poor mental health than those people who are in a standard employment relationship. So you can see a relationship, but they're not particularly strong, which indicates there's a lot of noise in this relationship, preventing us from seeing what's going on. If, on the other hand, you use an index like we did, which looks at the characteristics of the employment relationship, you see much stronger associations between being in precarious employment and, in this case, poor general health. In this here, those in precarious employment, that's the bottom 25% of our sample on the index, are 45% more likely to report poor general health than those in secure jobs. And if you look at mental health, it's almost twice as likely. So there's a much higher incidence of mental health amongst those in precarious employment using an index measure than compared to what we saw using the form. So I guess the first point here is that it's important to use something that's more precise in the form of the employment relationship to measure the true health effects, and the true health effects are massive. They're not marginal, they're quite massive. The second thing that we can do with the index, which I find quite intriguing, is to look at which components of the precarious employment index are most closely correlated with poor health and poor mental health. And so here what I've done is I've taken 8 of the components of our index and looked at how those individually are associated with poor health and poor mental health. And I think this is really quite fascinating. So the most significant factor, the biggest oomph for the fact comes from those people who said, if I was to raise a health and safety issue, that would jeopardize my future employment. So that, for them, they're over half as likely as other workers who are not in that situation to report poor general health. So what does that mean? Is you don't have a union, or you have a union where you can't say anything. There's no organization. That's very, very bad for your general health. Likewise, not knowing your schedule is the second most important factor affecting your general health. I think we've heard a little bit about this already, about how scheduling problems are an issue. Not knowing what your hours are going, if they're going to be reduced, is the third most important. And what's surprising is at the bottom, things like being paid in cash, not having benefits, and having your income vary are much weaker predictors of poor general health than the other three. And I think that's has important implications perhaps for policy in terms of how we move forward. If you look at the same kind of effects for mental health, you see the same basic pattern. So those people who say, if I was to put up my hand and say, excuse me, because we're Canadian, excuse me, but I think my job is killing me. If you don't feel you can do that, that is particularly bad for your mental health. And I think it's not surprising that'd be bad for your mental health. But also, if your hours are likely to be reduced, that's also very bad for your mental health. And if you don't know your schedule, that's very bad for your mental health. Whereas if your income varies, if you don't get benefits, if you're working on call, it's not great for your mental health, but it doesn't have the same kind of effect as these other variables. So again, I think that allows us to see in much more detail what is it about precarious employment that's affecting individuals' health, what kind of policy initiatives should we be looking at to make things better for those workers. Now, the other thing the third thing I wanted to talk about is this link between the household and the community and precarity and health. So again, this graph looks at the probability or the distribution of people who are saying, my employment relationship, it creates anxiety which interferes with personal or family life. So the link between work and household. People in precarious employment are more than 3 times more likely to say that they're anxious to the extent that it interferes with their personal or family life than people who are in secure employment, right? So the secure employment, these are the 1970s jobs, folks. The precarious employment, these are people who have all these characteristics of insecure work. And so there is a direct link between having an insecure job and having a household where there's anxiety and creating all kinds of problems. Now, the reason this is really quite critical, and I should have had one more intervening slide here, but I didn't, is there's also a very strong correlation between having anxiety at home as a result of your employment relationship and poor general and poor mental health. So people who say, yeah, I bring my work, my anxiety home, and it creates problems at home, are 2 to 3 times more likely to report poor mental health than people for whom that's less of an issue. Likewise, the other link is between community, and this was a question which asked, do you have friends at work who might be a source of support? And again, what we see is that people in precarious employment are much less likely to say, yeah, I've got a friend, I have a buddy at work who could lend me support, if there were problems at home, or I needed some help, or I needed help with a boss, which is almost every day, they could come and help me. People in secure employment have built up those networks, and so they have those forms of workplace support. Those people in precarious employment have not been able to build up those networks. They're isolated, they're moving from workplace to workplace, and so they lack that kind of support. Again, the reason this is important is because, there's a very strong correlation between not having a friend at work who could support you and poor mental health and poor general health. Right? So if you don't have a friend at work who can support you, you're again 2 to 3 times more likely to say, I have poor mental health, and you're 1.5 to 2 times more likely to say, I have poor general health. So, perfect. I'm going to give 5 minutes of my time to somebody else because I'm done pretty well. So the point here is that you can begin building these links, these pathways, and it's not just about the workplace that we need to be concerned about. It's about how this is affecting the household and how it's affecting communities. So my last slide, conclusions. Form of the employment relationship is a very crude measure of employment precarity. It makes it easy to write up studies that shows that precarious employment is not a problem. Precarious employment properly measured does affect general health and especially mental health where there are serious problems. Leading factors affecting health include lack of control over work schedule, unstable work hours, and the inability to exercise voice at work, quite critical, and potential paths of poor health as a result of employment precarity are through the households and through social isolation. I'll stop there.